If your feet have felt different lately, even slightly, your blood sugar may already be higher than it should be. And most people miss this stage completely because nothing feels serious yet. That is exactly how this process works. It does not start with a diagnosis. It starts quietly, while everything still feels normal on the surface. This is where it changes. Diabetes is not a single moment. It is a progression. And during that progression, the body begins adapting long before any lab result confirms it. Blood sugar stays elevated more often than it should. Insulin stays active longer than it should. And over time, that environment begins to stress the smallest and most sensitive systems first. Now, here is what most people miss. The first systems affected are not the ones you feel dramatically. It is the microcirculation and the nerves. And the feet sit at the far end of both. That makes them one of the earliest places where subtle damage becomes noticeable. Not obvious, not painful at first, but different. And that difference is the signal. In clinical practice, this shows up in a very specific way. People feel fine overall, no major complaints. But when asked directly about the feet, the answer changes. Something feels off. Not enough to worry about, just enough to notice. That is the stage where it gets ignored. I'm Dr. Olivia Kesson, cardiovascular surgeon, and this is one of the most consistent early patterns seen over time. The body signals early, but it does not signal loudly. Now, here is the problem. Most people are waiting for something dramatic before taking it seriously. But by the time symptoms feel serious, the process has already been developing for a while. This is why early recognition matters, because at this stage, the direction can still change. Now let's go straight into the first sign, because this is where almost everyone explains it away. Tingling or numbness that comes and goes without a clear reason. Not from sitting on a leg too long. Not from a temporary position, something that shows up repeatedly, especially at rest or at night. This is where most people say it must be nothing. Maybe circulation, maybe just age. But this is where it shifts. Frequent, unexplained tingling in the feet is often one of the earliest signs of peripheral nerve involvement, and peripheral neuropathy is strongly associated with elevated blood sugar over time. Now, here is what is actually happening. Nerves depend on a stable metabolic environment. When blood sugar remains elevated, it increases oxidative stress and low-grade inflammation. That environment begins to damage the outer protective structure of nerve fibers. Think of it like insulation around an electrical wire. When that insulation is intact, signals move clearly. When it starts to break down, the signal becomes distorted. That distortion is what feels like tingling. It is not random. It is a signal that transmission is no longer stable. Now, this is where most people get fooled. Because the symptom is mild, it gets dismissed. It does not interfere with daily life, so it does not feel urgent. But that is exactly why it matters. Early nerve changes are subtle before they become serious. This is the stage where intervention has the most impact, and it is also the stage most people ignore. Start a daily 20 to 30-minute walk. Consistent movement improves blood flow to the smallest vessels and helps protect nerve function over time. The longest nerves in the body are the most vulnerable. That is why the feet are affected first. That is not coincidence. That is anatomy. And once the signal starts there, it tends to progress gradually if the underlying cause is not addressed. This is where recognition becomes critical. Because once the pattern is understood, it is no longer vague. It becomes something specific that can be acted on. Now, this is exactly why small signs like this matter more than people realize. because understanding these early patterns allows action before damage becomes advanced. Now, here is where the pattern shifts again, and this is where many people feel it more clearly. Not numbness this time, but heat. A burning sensation, especially at night, that seems to come from inside the foot rather than anything external. This is where it becomes more obvious that something is not right. And this is where the mechanism becomes even clearer. Because when nerves are affected by prolonged exposure to elevated blood sugar, they do not always go quiet. Sometimes they become unstable. Signals are sent incorrectly. The brain receives a message that something is hot or painful, even when there is no external cause. This is not imagination. This is nerve signaling that has become unreliable. Increase daily water intake and add fiber to each meal, vegetables, legumes, and whole grains. This helps stabilize blood sugar levels and reduces metabolic stress on nerve tissue. Now, this is the part most people do not expect. The symptom feels external, but the origin is internal. And once that connection is made, the pattern becomes harder to ignore. Now, here is the key retention point. The body is not suddenly failing. It is signaling. It is showing early stress in systems that are highly sensitive to metabolic change. And the feet are often the first place where that signal becomes noticeable. That is why this matters. Because early recognition is the difference between managing a condition early and discovering it late. Now, in the next part, this moves beyond nerve signals into something more serious. What happens when circulation begins to slow and the body starts losing its ability to heal properly? And that is where the real risk begins to increase. If a small cut on your foot is still there days later, that is no longer a skin issue. That is a circulation signal. This is where things move from subtle to serious, and this is where many people get caught off guard. Because most people expect healing to be automatic. A blister, a scrape, a small crack in the skin, it should close. That is the expectation. But when blood sugar has been elevated over time, that process begins to slow down. Not suddenly, not dramatically at first, but enough to change the timeline. Now here is where it shifts. Healing is not just about the skin closing. It is a coordinated process that depends on blood flow, immune response, and nutrient delivery. And all of those depend on circulation. When blood sugar remains elevated, it affects the inner lining of blood vessels. They become less flexible, less responsive, and in the smallest vessels, the ones that feed the skin of the feet, blood flow becomes less efficient. This is where most people miss the connection. The body still has everything it needs to heal: oxygen, immune cells, nutrients, but it cannot deliver them efficiently to the exact location where they are needed. Now think about this in simple terms. Imagine trying to water a plant, but the hose is partially blocked. The water exists, but it is not reaching the roots properly. That is what impaired circulation does. The healing process slows, not because the body has stopped working, but because the delivery system is compromised. This is where a small delay becomes a pattern. A cut that should close in a few days lingers for a week. A blister from a shoe takes longer than expected. Skin that breaks takes longer to repair. At this stage, it may not feel dangerous, just inconvenient. But this is where the risk begins to build. Now here is the part that most people do not realize. When healing slows, the skin remains open longer. And when the skin remains open, even in a very small area, it becomes vulnerable. Bacteria that would normally be cleared easily now have more time to enter and multiply. This is how minor injuries turn into infections. Not overnight, but gradually. because the body cannot respond as quickly as it should. Now, this is where the pattern becomes critical. If this is happening once, it might be dismissed. If it happens repeatedly, that is no longer random. That is a system-level signal. And this is where the next layer comes in. Blood sugar does not just affect circulation. It also affects immune response. White blood cells become less effective in a high glucose environment. That means even when they reach the wound, their ability to fight infection is reduced. So now there are two problems happening at the same time: slower delivery and weaker defense. This is why small wounds in the feet become a serious concern when blood sugar is not controlled. A wound that does not heal normally is not just a local issue. It is a reflection of how well the entire system is functioning. And the feet show it first because they are the furthest point from central circulation. This is where early damage becomes visible before it shows up elsewhere. Check your feet every night. Look for cuts, blisters, or cracks. Clean them immediately. And if there is no improvement within 48 hours, contact your doctor. Now, this is the part most people get wrong. They focus on treating the surface, a cream, a bandage, a topical solution. And those can help, but they do not address the underlying issue if circulation is impaired. That is why the same problem can keep returning, because the root cause has not changed. Now, here is where it becomes more serious. When circulation continues to decline, the skin itself begins to change. It may become thinner, more fragile, easier to break. Color may shift slightly, sometimes darker, sometimes more reddish. These are not cosmetic changes. These are signs that oxygen delivery is not consistent. The tissue is not being nourished the way it should be. Now, this is where people often feel something, but cannot explain it. The feet feel more sensitive in some areas, less in others. The texture of the skin feels different. Shoes that were comfortable start to create pressure points. These are small changes, but they are not random. They are connected to how circulation and nerve function are changing together. Add 5 minutes of daily foot circulation exercises, ankle circles, toe raises, and calf stretches to improve blood flow into the smallest vessels. Now, here is the retention point. The body is not waiting for a diagnosis to begin showing signs. It is already showing them. And when healing slows, that is one of the clearest signals that circulation is under stress. This is why this stage matters so much, because it is still early enough to respond. Now, this is exactly why patterns like this matter more than people realize. A small wound that lingers, repeated skin breakdown, changes in how quickly the feet recover from minor irritation, these are all pieces of the same picture. And once you see that picture clearly, it becomes much harder to ignore. Now, this is where the pattern shifts again, because not all circulation changes feel like slow healing. Some show up as pressure, swelling, or tightness that seems unrelated at first. And that is where the next sign becomes even more revealing, because it connects circulation not just to the feet, but to how the kidneys and fluid balance are responding at the same time. If your socks are leaving deep marks in your skin by the end of the day, that is not just pressure from the fabric. That is fluid that is not moving the way it should. And this is where the pattern expands beyond nerves and healing into circulation and fluid balance working together. Because swelling in the feet and ankles is not random. It reflects how well the body is managing blood flow and fluid distribution over time. Now, here is where most people get it wrong. Swelling is often blamed on standing too long or sitting too long, and sometimes that is true. But when it becomes consistent, when it shows up most days. When the ankles feel tight or heavy by evening, that is no longer just positioning. That is a signal. This is where it shifts. The body is constantly moving fluid in and out of the bloodstream. That balance is controlled by the blood vessels and the kidneys working together. When blood sugar remains elevated over time, it begins to affect both. The vessels lose some of their ability to regulate pressure and fluid exchange, and the kidneys become less efficient at maintaining proper balance. Now here is the key detail. When the smallest blood vessels become less efficient, fluid starts to leak out into the surrounding tissue more easily. At the same time, if the kidneys are under stress, they may retain more sodium and water than they should. Those two changes together create a buildup of fluid in the lowest parts of the body. And that is why the feet and ankles are affected first. Now think about what this means in real terms. By the end of the day, gravity has already pulled fluid downward. If the system is working properly, that fluid is returned into circulation and processed. But when circulation is less efficient and fluid regulation is off, some of that fluid remains in the tissues. That is what creates swelling. This is not just a comfort issue. It is a circulation signal. Now here is the part most people miss. When you press on swollen skin, and it leaves an indentation that slowly fills back in, that is called pitting edema. And that tells you the fluid is sitting in the tissue longer than it should. That is not normal fluid movement. That is delayed return. If fluid is not moving efficiently, then circulation is not working efficiently. And if circulation is not working efficiently, then oxygen delivery, nutrient delivery, and waste removal are all affected at the same time. This is where the pattern becomes more serious, because this is no longer just about sensation or healing. It is about system performance. Now here is where people often feel something but do not connect it. The feet feel heavier at night. Shoes feel tighter by evening. The skin looks slightly stretched or shiny. These are not dramatic changes, but they are consistent. And consistency is what matters. Now this is where the kidneys come back into the picture. The kidneys regulate how much fluid stays in the body and how much is released. When blood sugar has been elevated for a long time, the filtering system becomes less precise. It may hold on to more fluid than necessary, especially when sodium intake is high. That combination increases the amount of fluid circulating and eventually settling in the lower body. This is where circulation and kidney function intersect. Elevate your feet for 15 to 20 minutes in the evening and reduce sodium intake from processed foods. This helps your body move excess fluid back into circulation. Now here is the retention point. Swelling in the feet is not just about standing or sitting. It is about how well the body is managing fluid under metabolic stress. And when that stress is driven by blood sugar, the pattern tends to be gradual and persistent. This is why it gets ignored, because it builds slowly enough to feel normal. Now this is where the pattern shifts again. Not everyone notices swelling first. Some people notice something different: temperature. Feet that feel cold even when the rest of the body feels warm. And that is where circulation becomes even more specific, because temperature is directly tied to blood flow. And when that changes, it tells you something very precise about how well blood is reaching the outer parts of the body. If your feet feel cold even when the room is warm, even under blankets, even when the rest of your body feels comfortable, that is not about temperature. That is about blood flow not reaching where it should. And this is where circulation becomes impossible to ignore, because temperature is one of the most direct reflections of how well blood is moving through the smallest vessels. Now, here is where most people get it wrong. Cold feet are often dismissed as poor circulation in a general sense, or just something that comes with age. But when the sensation is persistent, when it does not match the environment, when it shows up regardless of how warm the surroundings are, that changes the picture completely. This is where it shifts. Blood is responsible for carrying heat throughout the body. When circulation is efficient, warm blood reaches the outer tissues and maintains temperature. When vessels begin to narrow or lose flexibility, that flow becomes restricted. The furthest points, the feet, receive less warm blood, and the result is a cold sensation that does not resolve easily. Now, here is the part most people do not connect. Elevated blood sugar over time damages the inner lining of blood vessels. This process, often referred to as endothelial dysfunction, reduces the ability of vessels to expand and contract properly. That means blood cannot adjust flow as efficiently in response to the body's needs. And when that happens in the smallest vessels, the effect shows up as reduced warmth in the extremities. Now think about this carefully. The feet are at the end of the longest vascular pathways in the body. Any reduction in flow is amplified there. That is why the feet become one of the first places where temperature changes are noticeable. This is not random. It is a reflection of how well the vascular system is functioning under metabolic stress. Now, this is where the pattern becomes more specific. Cold feet that persist across different environments, cold even when covered, cold even when the rest of the body feels warm, these are not external temperature problems. They are internal circulation signals. Start a daily 20 to 30-minute brisk walk to improve blood flow and help restore circulation to the lower extremities. Now here is where it becomes more serious. When blood flow is reduced consistently, tissues do not just feel cold. They receive less oxygen and fewer nutrients. Over time, that affects how well the tissue maintains itself. Skin becomes thinner. Hair growth decreases. Small injuries take longer to heal. This is where circulation, nerve function, and tissue health all begin to intersect. If blood is not reaching the outer tissues effectively, then everything those tissues depend on is also reduced. That includes immune response. That includes repair mechanisms. That includes the ability to maintain normal structure. This is why circulation changes are not just about comfort. They are about function. Now, this is where many people start to notice another subtle shift. The skin on the feet begins to change. It may look drier, more fragile, or slightly different in texture. And this leads directly into the next sign, because what appears to be a simple skin issue is often something much deeper. Now, this is where people get fooled again. Dry, cracked heels are almost always blamed on weather or lack of moisture. And in many cases, that is true. But when dryness becomes persistent, when cracks deepen, when no amount of lotion seems to fully resolve the problem, that is no longer just a surface issue. This is where it shifts into nerve function. Because the skin depends on more than external moisture. It depends on internal regulation controlled by the autonomic nervous system. That system controls sweat production and natural hydration of the skin. When blood sugar affects those nerves, the skin begins to lose moisture from the inside out. Now here is the key detail. This type of dryness does not respond fully to external treatment because the source is internal. The skin barrier weakens. Small cracks form, and those cracks are not just cosmetic, they are entry points for bacteria. Moisturize your feet daily, especially the heels, and maintain proper hydration by drinking enough water throughout the day to support skin integrity from within. Now think about how this connects to everything before. Reduced circulation slows healing. Impaired nerve function alters sensation. And now compromised skin integrity creates vulnerability. These are not separate problems. They are parts of the same process. Now this is the retention point. The body is layering signals: temperature change, skin change, sensation change. Each one on its own may seem small, but together they form a pattern that points to how blood sugar is affecting the system. And once that pattern is visible, it becomes much harder to ignore. Now this is where the pattern shifts one more time, because not all nerve changes reduce sensation. Some do the opposite. They amplify it into something sharp, sudden, and impossible to overlook. And that is where the next sign becomes one of the most uncomfortable and one of the most commonly misunderstood. If your foot suddenly sends a sharp electric shock of pain for no clear reason, that is not a joint problem, and it is not something to ignore. That is a nerve signal that has become unstable. And this is where the pattern becomes impossible to dismiss, because the body is no longer whispering. It is forcing attention. Now here is where most people get it wrong. Sudden foot pain is almost always blamed on something mechanical: arthritis, an old injury, pressure from shoes, overuse. And sometimes that is correct. But when the pain appears without a clear trigger, especially at rest or at night, that explanation starts to fall apart. This is where it shifts. Nerves that have been exposed to elevated blood sugar over time do not always lose function gradually. Sometimes they become hyperactive. Instead of going quiet, they begin firing erratic signals. The brain receives those signals as sharp pain, burning, stabbing, or even electrical sensations. And because nothing external caused it, the pain feels confusing and unpredictable. Now here is the part most people miss. Pain like this is not coming from the surface. It is coming from within the nerve itself. The signal is real, but the source is not injury. It is dysfunction. Now think about this carefully. A healthy nerve sends signals only when there is a reason: pressure, temperature, contact. A damaged nerve can send signals without any external input at all. That is why the pain can appear suddenly and disappear just as quickly. This is not random. It reflects instability in the signaling system. Now, this is where people often make a critical mistake. The response is to suppress the pain. Over-the-counter medications, anti-inflammatory drugs, temporary relief. But those approaches do not address the cause if the issue is nerve dysfunction. The signal is being muted, but the underlying process continues. And that is why the pattern returns. Add 5 minutes of gentle foot and ankle movement each morning and evening, simple stretches and light massage to stimulate nerve signaling and improve blood flow. Now here is where the timing becomes important. These sensations often become more noticeable at night. Not because the condition worsens at night, but because there are fewer distractions. During the day, movement, pressure, and sensory input compete with the signal. At night, when everything becomes quiet, the abnormal nerve firing becomes more obvious. This is where many people first recognize that something is not right. If nerves are misfiring, circulation is already affected, and healing is already slower, then multiple systems are being impacted at the same time. That is not an isolated symptom. That is a pattern. Now this is where the final layer becomes visible, and this is the one that almost no one notices until it is pointed out. It is not something you feel. It is something you see. And once you see it, you cannot unsee it. Hair on the lower legs and feet becoming thinner or disappearing altogether. Now, here is why that matters. Hair follicles require a consistent supply of oxygen and nutrients to function. When circulation is reduced over time, those follicles receive less support, and gradually, they stop producing hair. This does not happen overnight. It happens slowly, which is exactly why it goes unnoticed. Now, this is the key detail. This is not about aging alone. It is about blood flow. When the delivery system is compromised, the most non-essential functions are the first to decline. Hair growth is one of them. Now think about what that represents. If circulation is reduced enough to affect hair growth, it is also affecting everything else in that area: skin health, nerve function, healing capacity. This is not a cosmetic change. It is a visible marker of underlying vascular stress. Schedule a blood glucose test this week and begin daily walking to improve circulation and confirm what your body may already be signaling. Now, this is the retention point. The body has been sending signals all along: sensation changes, temperature changes, healing delays, swelling, skin changes, pain, and now visible structural changes. Each one builds on the last, and together, they tell a clear story about what is happening beneath the surface. None of this starts at the stage where it is too late. These are early to mid-stage signals. That means there is still time to respond. And that response does not begin with guessing. It begins with confirming. A simple blood glucose test can reveal what the body has already been showing. Now think about the cost of missing that window. The longer elevated blood sugar goes unrecognized, the more these systems continue to change. And over time, those changes become harder to reverse. That is why early recognition matters more than anything else. Because once the pattern is clear, the next step becomes obvious. Not waiting, not guessing, acting. Help Dr. Kesson reach 1,000 subscribers. Subscribe, leave a like, and let this information reach the people who need it.